My name is Karina, and I'm excited to tell you about a coalition that's on a mission to advance maternal health and well-being for Black and American Indian people and their communities. It's called the Birth Justice Collaborative, or BJC, and it was launched in August of 2022 when 4 Black and American Indian-led organizations partnered with Hennepin County to engage their communities in co-designing strategies to improve birth outcomes for Black and American Indian people.
A woman who's going through labor, it's one of the most spiritual things you could ever go through in your life, and that's for all people. But our society doesn't set up women to truly believe and realize how connected they are to their ancestors, to the women before them through this practice. Being able to share that is decolonizing, is connecting back to our original instructions. It's restoring the most beautiful part of our spirituality, and that's birth.
While we have this great healthcare system in Minnesota, it doesn't work as well for Black folks, for Indigenous folks, for people of color, for people with not a lot of means. And so that's dangerous, right?
American Indian women and birthing people are nearly 8 times more likely to experience maternal death than white Minnesotans. And U.S.-born Black and African Americans were nearly 3 times more likely to experience maternal death than white Minnesotans. These disparities are fueled by societal, institutional, and interpersonal barriers to maternal health that are deeply rooted in racist constructs embedded within systems, and they are negatively impacting care and support.
The very foundation of gynecological sort of work, studies, discipline was based off of sort of racist underpinnings, right? So this idea and racist notions, one that Black women could bear more pain, or Black people were not fully human. And so J. Marion Sims, who's noted as the father of gynecology, he experimented on enslaved women without consent or anesthesia. Some women up to 30 times or 40 times, right? And so the idea of racism in sort of maternal health is embedded from its very beginning.
I had an 8-day hospital stay in total, and saw lots of different rounds of healthcare providers and hospital staff. And I honestly felt that I was somehow center of attention, yet invisible. I would have my husband, who's white, speak up and say the exact same things that I had said to other providers throughout the experience, and they would listen when I was ignored.
When we talk about babies dying and we talk about mamas dying early, we're actually talking about also the destruction of Black families and Native families. So when we look at a systems analysis of what that means, it is exponential, it is complicated grief, it is lack of opportunity, and all of those things are directly tied into the inequity of racism.
Fortunately, a movement is building to advance birth justice for American Indian and Black people in Minnesota. The work started by convening over 300 community members to identify what they know will help improve maternal health.
And I get chills every single time we're in the same room together because it reminds me of the conversations I've heard all my life growing up of women talking about in my family and in community space about the things that we were being challenged by, and talking about strategies on how to resolve those conditions and coming up with really, really inventive ways to address that.
Following the convenings, 30 of the community members, along with 20 health system, payer, and government representatives, formed a leadership coalition that shaped the community guidance into 5 main strategies that reflect the future we want to live into. They include acknowledging and addressing the impacts of racism, investing in a network of community providers and resources that community endorses and trusts to support them, creating culturally meaningful workforce pathways, enforcing a coordinated system of anti-bias and accountability, and advocating and radically reforming policy and payment.
Medical care within a Western construct does not really support traditional birthing practices. So like when we want to decolonize birth, systems don't really understand what that means. And for us, it could be as simple as making sure that we have access to our spiritual beliefs within the institution. Or for some folks, it means being able to have safe and comfortable deliveries, whether that's within a hospital or at home.
Having partnerships between the systems and community-based organizations is crucial. Systems can't do it on their own. Community-based organizations can't do it on their own, but together they can. And in those instances, which are many, where we can't have a Black doctor or an American Indian nurse, at least we have the community-based supports to be that bridge, to be that cultural bridge, if you will.
With initiatives like the Birth Justice Collaborative, we can start to say, this is a collective experience, and these are our solutions about how you can change your practice. And one of the best ways to do that is for systems to realize that they're accountable for the structural racism that they perpetuate at the point of care.
I think the policy work is a strategy that's really going to make a big difference if we can get the legislation to work the way that we want to. I think that we can make a big difference in our families' lives.
How do we incentivize in the maternal health process utilizing perinatal centers? Because we know that they get different and what I would say is better results. How do we incentivize pay to scale doulas and midwives as part of the care plan?
The Birth Justice Collaborative is an example of community solutions, how it should be done. Like there should be a multiple variety of access points for community. It needs to be in person, it needs to be online, it needs to be in their neighborhood, in their comfort community spaces. And then you need to feed them the food that they want to eat. And you need to give incentives and have childcare. And I think that the Birth Justice Collaborative has done this very well.
I am most excited about seeing the empowerment of our women, to see communities come together and help each other.
And so we need everybody around the table, because it's not just their gifts, it's your gifts. What do you have that you can bring wholeheartedly to the table, knowing that no one is perfect? So if you think you're coming into a panacea, don't bother. But if you're coming willing to bring everything you have for the next generation, please come. We need you. We need you. Please come.